Welcome to Understanding Arthritis. Learn about its impact on joint health. Arthritis comes in different types. Let's explore them. Osteoarthritis and rheumatoid arthritis are the most common types of arthritis. Other types include gout, psoriatic arthritis, and reactive arthritis. Various factors can contribute to the development of arthritis. These include age, family history, joint injuries, obesity, and autoimmune conditions. Arthritis can cause several symptoms that affect daily life. Experience joint pain, stiffness, swelling, redness, and decreased range of motion. Diagnosing arthritis involves various exams and tests. Physical exams, laboratory tests, and imaging help determine the condition. There are different treatment options available for arthritis. Medications, physical therapy, lifestyle changes, and surgery can help manage the condition. In conclusion, early diagnosis and management of arthritis are crucial. Take control of your joint health and live a better life.
What is arthritis? Arthritis is the swelling and tenderness of one or more joints. The main symptoms of arthritis are joint pain and stiffness, which typically worsen with age. Osteoarthritis and rheumatoid arthritis are the most common types of arthritis. Osteoarthritis and rheumatoid arthritis are diseases that cause cartilage to break down. Gout is caused by uric acid crystals that form when your blood has too much of this substance. Diseases such as psoriasis or lupus can cause other types of arthritis. Arthritis treatments vary depending on the type of arthritis. The main goals of treatment for arthritis are to reduce symptoms and improve the quality of life. Types arthritis. Arthritis is a group of diseases that cause pain, swelling and stiffness in the joints. It can also lead to limited movement around your joints. There are over 100 different types of arthritis, including osteoarthritis, rheumatoid arthritis, and psoriatic arthritis. Arthritis is not a single condition but rather a spectrum of joint-related disorders including conditions like osteoporosis, gout and pseudogout. The most common type of arthritis is osteoarthritis, which symptoms and treatment. Arthritis is a painful condition that occurs when the joints in the body wear down over time. This chronic condition can lead to significant pain and stiffness if left untreated. The specific type of arthritis you are diagnosed with will determine what treatment options you have available, so it's important to seek out an experienced doctor who can determine which form of arthritis you have. Some of the most common types of arthritis include osteoarthritis, rheumatoid arthritis, PS. Arthritis is a group of diseases that affect the joints, muscles, and other tissues that connect one bone to another in the body. It is estimated that about 20 million people in the United States have arthritis. There are more than 100 different types of arthritis, but they can be put into two main categories: ankylosing spondylitis, gout, juvenile idiopathic arthritis, osteoarthritis, psoriatic arthritis, reactive arthritis, rheumatoid arthritis, septic arthritis, thumb arthritis. Symptoms. Arthritis. Arthritis is a condition that affects the joints. Signs and symptoms may include pain, stiffness, swelling, redness, decreased range of motion. When to see a doctor: geriatric medicine, rheumatology. If you have pain or stiffness in your joints that doesn't go away, see a doctor. Causes arthritis. Arthritis is one of the most common diseases in the country. There are over 100 different types of arthritis, and there are many symptoms that go along with it. Arthritis is not just a disease that affects the elderly. In fact, arthritis affects people of all ages. The fact is that more than 50 million Americans suffer from some form of arthritis or other joint disorder, and even more troubling, 5 million children suffer from these conditions. Arthritis is one of the most common medical conditions in the United States, and it's estimated that 8.3 million people have some form of arthritis in the hands and wrists alone. In fact, arthritis affects approximately 46 million Americans, including those over 65 years old. Arthritis can be classified into two main types: osteoarthritis and rheumatoid arthritis. Osteoarthritis damages joints in a way that is similar to the way they develop over time, while rheumatoid arthritis causes inflammation and damage to the joints. Risk factors. Arthritis. Risk factors for arthritis include family history. If you have arthritis, it is likely because some members of your family have the condition. As we age, the risk of many types of arthritis increases. These include osteoarthritis, rheumatoid arthritis, and gout. Your sex, women are more likely to develop rheumatoid arthritis, while most people who have gout have a different type of arthritis. Previous joint injury, people who have injured a joint may eventually develop arthritis in that joint. Obesity is a big problem because it puts a lot of stress on joints, especially your knees, hips, and back. People who are obese are more likely to develop arthritis. Complications: arthritis. If you have arthritis, it can make it difficult for you to do everyday tasks. If arthritis affects your hands or arms, you may not be able to walk comfortably or sit up straight. In some cases, joints may gradually lose their shape and alignment. After hip replacements, you may experience some pain relief. After hip replacement surgeries, Mara Olson no longer experiences pain and is able to resume her usual activities. That's just what her surgeon and her 2 dogs wanted for her. Mara Olson and her dogs Ellie and T had a good thing going. Every day they would walk in the fields behind her home. Then one day, one of Mara Olson's surgeons said to Ellie, "Hey Ellie, let's go find some new friends." And that's how Mara Olson met her 2 dogs T. And now this passage describes how to make decoupage. When decoupage dries, it becomes a clear substance that is made up of glue. Diagnosis: arthritis. During the physical exam, doctors check your joints for swelling, redness, and warmth. They'll also want to see how well you can move your joints. Laboratory tests. An analysis of different types of body fluids can help identify the type of arthritis you may have. Fluids that are commonly analyzed include blood, urine, and joint fluid. To collect a sample of joint fluid, doctors cleanse and numb the area before inserting a needle into the joint space to withdraw some fluid. These kinds of tests can identify problems within the joint that may be causing your symptoms. Examples include 1. Joint X-rays to see if there is any damage to the joint. 2. MRI, magnetic resonance imaging, scans to detect any abnormalities in the bones and cartilage of the joint. And 3. CT, computed tomography, scans to look at the inside of the joint. X-rays at low doses can show bone damage, cartilage loss, and bone spurs. This information may not be available from regular X-rays, but they are often used to track the progression of arthritis. Computerized tomography, CT scans take many X-ray pictures from different angles and combine them to create cross-sectional views of the body's internal structures. CTs can see both bones and the soft tissues around them. Magnetic resonance imaging, MRIs can produce more detailed cross-sectional images of soft tissues by combining radio waves with a strong magnetic field. Ultrasound is a technology that uses high-frequency sound waves to see soft tissues near the joints, such as cartilage and fluid-containing structures. It is also used to guide needle placement for removing joint fluid or injecting medications into the joint. Electromyography. Treatment: arthritis. Orthopedic surgery. Arthritis is a term that encompasses many different joint disorders. The most common form of arthritis is osteoarthritis, which occurs when the cartilage that cushions the ends of bones deteriorates and wears down. Other forms of arthritis include rheumatoid arthritis, psoriatic arthritis, gout, and lupus. Arthritis is a lifelong condition that affects more than 50 million Americans. It can occur at any age, but most commonly affects people over the age of 40. There are over 100 different forms of arthritis, which can affect your bones, joints, muscles, or connective tissues, ligaments, and tendons. Many people with arthritis live healthy, active lives. In a nutshell, the most effective treatment for arthritis is a holistic approach that includes medical care and exercise. One of the first steps to treating arthritis is figuring out which type you have. There are many different types of arthritis, some of which are specific to certain joints. The next step is determining whether your symptoms can be treated with medication or not. If there are no drugs that work for you, physical therapy may be an option to help relieve pain and inflammation. Also, if you have treatment for arthritis focuses on relieving symptoms and improving joint function, you may need to try a variety of treatments before you find one that is most effective for you. Medications. Depending on the type of arthritis, different medications are used to treat it. Commonly used arthritis medications include NSAIDs. Non-steroidal anti-inflammatory drugs, NSAIDs, can relieve pain and reduce inflammation. Some examples include ibuprofen, Advil, Motrin IB, others, and naproxen sodium, Aleve. NSAIDs are available in different strengths, which may cause stomach irritation. However, stronger NSAIDs may also increase your risk of heart attack or stroke. You can apply creams or gels to joints for relief. Counterirritants. Some creams and ointments contain menthol or capsaicin, which is the ingredient that makes hot peppers spicy. If you rub these preparations on your skin over your aching joint, it may stop the transmission of pain signals from the joint. Steroids. Corticosteroid medications such as prednisone can reduce inflammation and pain, and may slow joint damage. Side effects may include thinning of bones, weight gain, and diabetes. Anti-inflammatory drugs, AIDs. These medications can slow the progression of rheumatoid arthritis and protect the joints from permanent damage. In addition to conventional medications, there are also biologic agents and targeted synthetic medications. Side effects can vary, but most medications increase your risk of infections. Therapy. Physical therapy can help some people with arthritis. Exercises can improve range of motion and strengthen the muscles around joints. In some cases, splints or braces may be necessary. Surgery. If conservative measures don't help, doctors may suggest surgery such as a biopsy. Joint repair. Joint surfaces can be smoothed or realigned to reduce pain and improve function. This can often be done through surgery, through small incisions over the joint. Joint replacement. This process removes the damaged joint and replaces it with an artery. Lifestyle and home remedies. Arthritis symptoms can often be reduced with the following measures. Weight loss. If you are overweight, it puts extra stress on your joints. Losing weight may make you more mobile and less likely to injure your joints in the future. Exercise. Exercise can help keep joints flexible. Swimming and water aerobics may be good choices because they are low-impact activities that do not put stress on the weight-bearing joints. Heat and cold. If arthritis pain is severe, warming pads or ice packs may help relieve the pain. Assistive devices. Walkers and cane shoe inserts can help protect joints and make it easier to perform daily tasks. Alternative medicine. There is little reliable evidence to support the use of many alternative remedies for arthritis, including, some people use alternative remedies for arthritis, but there is little evidence to support their use. Some possible alternative remedies for arthritis include acupuncture. This therapy uses fine needles to reduce pain in various areas of the skin. This can be helpful for people with arthritis. Glucosamine. Some studies have found that glucosamine does not work better than a placebo. However, both glucosamine and the placebo relieved pain in people with moderate to severe knee osteoarthritis better than nothing. Chondroitin. Chondroitin may provide some relief from osteoarthritis, although the results of studies are mixed. Fish oil. Some preliminary studies have found that taking fish oil supplements may reduce the symptoms of some types of arthritis. Make sure to tell your doctor if you are taking fish oil, as it can interfere with some medications. Yoga and Tai Chi. Yoga and Tai Chi may help improve joint flexibility. These slow movements may help increase range of motion. Massage. Massage may increase blood flow and warm affected joints temporarily, relieving pain. Make sure the massage therapist knows which joints are affected by arthritis. Preparing for your appointment. If you have symptoms that you think might be related to your joints, your family doctor may refer you to a doctor who specializes in the treatment of joint problems, rheumatologist. What you can do. Before your appointment, make a list that includes what you would like to discuss, the time of your appointment, your contact information, detailed descriptions of your symptoms. This passage includes information about medical problems that you have experienced in the past. This information is about the medical problems of your parents or siblings. All of the medications and supplements you take will be taken into account when your doctor makes a diagnosis. Questions you want to ask the doctor. What to expect from your doctor. Your doctor may ask some of the following questions if you are planning to have a surgery. When did your symptoms start? What is the difference between activity and rest? Which joints are painful? Do you have a family history of joint pain?